Hello friends, I am Dr. Abid and today I am going to discuss some health issues with you. First health issue is the angina, second health issue is heart attack, and the third health issue I will discuss with you is the heart failure. Angina and heart attack are collectively called coronary artery disease or ischemic heart disease. People usually think that a heart attack and a heart failure are the same thing, but as we will see, they are two different things. First, let me tell you something about angina. Angina is usually a chest pain which is due to the narrowing of the arteries of the heart. Although angina usually present with chest pain, but it can also present as pain in the neck, arms, shoulders or jaw. Angina is due to the narrowing of the arteries of the heart supplying blood to the heart. Angina is more likely to occur after physical activity, especially if you are engaged in physical activity after a meal or in a cold weather. Most important thing to do in angina is to stop physical activity, and if pain continues, put the tablet for the relief of angina under the tongue. If you ignore angina and keep on doing physical activity, angina can convert into heart attack. In angina, there is no actual damage to the heart as the blood supply is only temporarily restricted. While in heart attack, there is damage to the heart which can be minimized by treatment as early as possible. Now let's discuss about heart attack. Heart attack is due to the formation of a clot in the narrowed arteries supplying blood to the heart. Pain of the heart attack is more severe than angina and may be accompanied by nausea, vomiting, sweating, palpitation, or shortness of breath. Most important thing to do in heart attack is to somehow break up the clot in the arteries of the heart. This can only be done only in hospital setting and can only be done within 12 hours of the onset of the pain of heart attack, as breaking the clot after 12 hours doesn't do anything good. Moreover, earlier the clot is broken, the better it is. So in heart attack patient should be taken to the hospital without wasting any time. The angina and heart attack collectively are called coronary artery disease or ischemic heart disease. Another important thing about heart attack or angina is that in about 50% of the patient there is no narrowing of the arteries of the heart, so-called non-obstructive coronary artery disease. In this patient, when we do angiography, we don't see any obstruction in the arteries. I will post a link down from where you can know more details about the non-obstructive coronary artery disease. Now we come to the topic of heart failure. Heart failure is the condition in which heart is weak and cannot pump enough blood needed by the body. Any disease which weakens the heart, for example heart attack or high blood pressure, can cause heart failure. In heart failure, patients feel shortness of breath and there can also be swelling of the feet. Heart failure by itself is not a disease, but it is a result of many diseases which cause weakening of the heart. For example, a massive heart attack or repeated heart attacks or uncontrolled hypertension can cause heart failure. Heart failure patients are given drugs promoting urine flow, which reduces the swelling of the feet and also helps with the shortness of breath. In all of the three conditions described above, that is angina, heart attack, and heart failure, patients need to take medicine usually for whole life because it is important to improve the symptoms and increase the life expectancy. If you like my videos and find it informative, please subscribe to my channel. I will keep on posting more videos regarding more health issues for you.